The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. It's Tuesday morning, and we are gathered here for the next episode of TMD Demystified. Today's topic title is regarding TMD, TMJ, what is needed and wanted. Regarding this problem, which most people call TMJ, and still do, what is needed and wanted regarding this problem? We're going to discuss that in a very specific way as to my experience with what is needed and wanted in a general way, and then apply that to TMD, TMJ. I'll give all the listeners, followers, viewers a little insight into this thing called needed and wanted. It's a very specific concept, and if you apply it to pretty much any problem or situation you have in your life, it is somewhat magical as to the results, the good results that come from it. I'll start out with just a little soliloquy, just a little story regarding this, and then we'll apply it. We'll go further into how that applies to this huge problem that we call TMJ, that as of today's date, which is July 2nd, 2024, the consensus is when it comes to TMJ, nothing works. And they call groups together to study it through the National Academy of Sciences, Engineering, and Medicine, and they bring out the big guns from major universities and dental schools and gather all kind of, quote, specialists to study the problem. But no one really looks at the basic concepts behind what they're trying to solve and why. So let me tell you this little story. So I personally have founded two medical clinics, medical quote / dental clinics, doing both medicine and dentistry in two third world countries, Haiti and Jamaica. And way back in 1979, I founded a medical dental clinic in Haiti, out in the middle of the bushland, where these people had never seen a Western doctor. I was the first Western doctor that they had ever seen within about a 75-mile radius. But I learned a lot. I won't go into that. I learned a tremendous amount. We had a very successful clinic, very individual, pretty much myself, and then I would bring friends of mine to help me in his clinic. But associated with it, I had developed quite a reputation, and I was asked, springboarding from that, to develop a clinic in Jamaica, similar situation in Jamaica. And this was back now in around the early 90s. And I had a burgeoning office and a burgeoning practice. I was very, very busy. But I told the person who was a minister who had tried for 20 years to get a clinic going in Jamaica and was unsuccessful getting any kind of clinic started, I told him I would only talk to the head person in healthcare in Jamaica if he wanted me to help. I had to have an appointment with the head person in healthcare, because one of the things I learned in Haiti was that you could not rely on anything from any of the people down the line, and the only person who could make a decision was the head person in that particular department or service. And I learned that the hard way. So make this short, the individual, I thought, well, that'd be the end of it. I'd never hear from him again. And within a month or so, I got a call from him, and he said, Dr. Urbanek, you have now an appointment with the Minister of Health in the island of Jamaica. Well, when would you like to set the appointment? Again, to shorten it up, I set the appointment. I swallowed hard because it was more work and more responsibility than I really wanted to take on. But I flew the minister and myself, my wife, down to Haiti down to Jamaica, and met with the Minister of Health. And not only did I meet with the Minister of Health, but the meeting itself was a very formal thing where he brought in his 10, there were literally 10 people in the room besides the Minister of Health in all areas of healthcare on the island. And after we exchanged pleasantries and we drank tea and had cookies in the British way, he said, Dr. Urbanek, why are you here? What do you want to talk with me about? And I knew exactly how I was going to approach this, because one of the things I learned in Haiti was that third world decision makers are very proud. And although they have very little resources, they're very proud of what they do have, and they don't like outsiders coming in and telling them what they want to do for them. I learned that again, the hard way in Haiti. So when I was asked that question by the Minister of Health, the Honorable Eastman Douglas was his name, he and everyone in the room was very, very tight. They were very stilted. I don't know what they thought about me, but I went on to tell them what my resources were, that I was president of the Flying Physician Association, that I was associated with and could represent the Rotary International and a company and a charity called Aid International. Told them what our resources were along those lines for those three organizations. And then I said the magic word. And I gave them the magic statement. I said, I am not here to tell you what we want to do for you. I am here to ask you what is needed and wanted. And at that point, it's like the bubble in the room, just like the air went out of it. And you could see everyone along the sides of the table, their shoulders went down, and they kind of looked down at me at the end of the conference table in a much more relaxed way. And the Minister of Health went silent for literally for almost a minute. And he just looked at me, and he went on to ask a couple additional questions about our resources and things. I don't even remember what the questions were, simple questions to answer. And then he said to me, we have 5 buildings on the north coast of Jamaica between Montego Bay and Ocho Rios. We have 5 buildings on the water on the north coast of Jamaica. Beautiful view. And we have one physician, who goes to those 5 buildings 1/2 day a month to service 50,000 people. And he said, if you will institute a practice in those 5 buildings, we will give you those 5 buildings and allow you to institute a practice for our people in Jamaica. I was stunned. The minister who was in the room was stunned. But I certainly took a win on it, but I knew at that point what had happened and why, and that what I offered, what I asked, was not what we were going to do for them, but just ask what is needed and wanted, and then have resources to supply that and do that. And that's what happened. And over the next 10 years, that clinic was developed into all aspects of medical care, including general medical care, obstetrics, general surgery, dentistry, all aspects of dentistry. And we ended up with doctors flying in and coming from all over the world for short stints 2 or 3 week stints to service the people of Jamaica on the North Coast within those 5 buildings. So those magic words, what is needed and wanted, is very critical when you undertake a project or have a problem you want to solve. And so regarding TMJ, it is a problem. Admittedly, it is a problem for the doctors, the dentists who take on the responsibility. Most don't want the responsibility. We've talked about that because everybody knows nothing works, which is not true. We know now what works. We are absolutely certain of what works. If you get rid of the inflammation within the temporomandibular joint, no matter how badly the joint looks on an X-ray, no matter how much degenerative change is within the joint, no matter what the symptoms are, no matter how long the symptoms have gone on, no matter how many of the symptoms are present, if you decrease the inflammation within the temporomandibular joint, the symptoms decrease. And the best way to decrease the inflammation within the temporomandibular joint is to unload the joint, like a set of crutches unloads a bad knee. And the best way to do that is to separate the posterior teeth over a critical period of time, which is 24/7 for 2 months, and then nighttime only the rest of the patient's life. We usually get them there and keep that inflammation at bay to allow the symptoms to decrease, and then they learn to use that tool correctly. But you have to start out in a strong way, 24/7, at least 24/7 for 2 months, and then nighttime or when the patient sleeps the rest of the patient's life. Now, we know that is the solution, and we apply it. We have applied it to thousands of patients, not only in this practice, but in the increasing number of practices throughout the United States who are licensed to do that protocol and use that device, and an anterior posterior disoccluding device and protocol. Now, what is needed and wanted is the remaining folks out there, medical types, who are trying to solve this problem in their own way, to diminish their biases. Because going back to that episode on the island of Jamaica I talked about, what I did was, instead of bringing my biases into that meeting and tell the Minister of Health what I thought he should do, allow us to do, using those resources, I simply asked what's needed and wanted. And I did not bring my biases into the meeting, into the problem. I just asked what's needed and wanted. And then the magic happened. Now, this same issue, this same problem, these same circumstances apply to TMJ, TMD, for sure. You know, we have this problem that is attempted to be addressed by a group of professionals. Those professionals are general dentists, primary care physicians, oral and maxillofacial surgeons, ENT doctors, orthodontists, neurologists, chiropractors, physical therapists, convenient care clinic nurse practitioners, acupuncturists, psychologists, psychiatrists, and maybe voodoo doctors, because frankly, a lot of the stuff that is used out there on temporomandibular joint is no better than voodoo. And I'm very familiar with voodoo because of my experience with my clinic in Jamaica, in Haiti, in 1979, 1980, 1981, where I did not make friends with the voodoo doctor. Actually, he tried to do away with me. Obviously not successful, but he definitely did his best to get rid of his competition. But those are the people, those are the individuals, the groups, the titles of the doctors and healthcare professionals that see patients with the symptoms of TMD constantly, not occasionally, but constantly. Headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling, numbness, and various kinds of jaw locking, inability to open. They see patients all the time. And the problem is they're biased. They bring their bias into the solution. And what is their bias? Well, their bias is the narrow area that they have learned in the past. Whether it be, the general dentist or the neurologist, they bring their own knowledge, training, experience, but very narrowly in their area. And by doing that, they overlook and actually can't even at times understand the simplicity of solving the problem. The general dentist thinks the problem is related to teeth and tries to solve the problem by modifying teeth. The primary care physician tries to solve the symptoms by trying different kinds of drugs. The oral and maxillofacial surgeon tries to solve the symptoms using various types of surgery. I have a lot of experience with that until I gave up my bias. The orthodontist tries to solve the symptoms by moving teeth. The psychologist tries to solve the symptoms by changing the patient's attitude. The psychiatrist does the same by using drugs. And the acupuncturist uses ancient Chinese methods. And of course, we already talked about the voodoo doctor and his inability to solve his problem at the time, which was me, using voodoo. Although he did his best. That's a whole other episode that probably won't come on this podcast, but a very interesting story how that all turned out. So the issue is, can these other doctor types take away their biases, look at it independently, individually, without a bias, look at the facts, which have been generated with over 4,000 now in this single practice successfully treated patients in an independent study showing that when you decrease inflammation within the temporomandibular joint, the symptoms decrease. It's that simple. Of course, you have to do it correctly according to a protocol, and you have to make sure the patient goes through the protocol, which is very simple, easy to do, not a problem. So that is the issue, and you have to ask what's needed and wanted rather than bring your primary biases into the situation. Now, this thing called needed and wanted works on any kind of problem or situation you have in your life. We just applied it to TMD, and that's what this podcast is about. That's what I'm all about, educating, helping doctors and patients solve this supposedly unsolvable TMD problem. But it all starts out with decreasing your biases. So this is what I ask. I ask if you are watching this, that you basically pause, whether you pause the episode or just pause your mind and think about what your biases are regarding the issue. I mean, all of these folks that I just mentioned, all of these healthcare providers, they, for whatever their reasons are, whether it's academic or financial or just because they like to help people, apply their types of treatment, but they have biases that doesn't allow them to look elsewhere and to look at it objectively. So if you're watching this, what I ask is that you look at yourself and determine what are your biases regarding TMD. You can use this in any issue or problem you have in your life, including family issues, business issues, social issues, economic issues, political issues. But we're just sticking to TMD here. And take a look at yourself and ask yourself, what are my biases? Which is what I did 13 years ago when I spent the weekend thinking about the results of applying surgical treatments to the temporomandibular joint problem and finding that or more of the patients would be back in a year or two with the same symptoms. Well, that's not a successful action. That is not what I would call, and I did not call that successful. When I did orthognathic surgery, which I was very, very busy doing orthognathic surgery, or microneural surgery, reconnecting nerves in the face, or cleft palate surgery and bone grafting for cleft lip and cleft palate, I always knew what the outcome would be, and it would be successful. If you did the surgery correctly, you would have a successful action, which continued on, and you could predict it. But when it came to TMJ surgery, you could not fully predict it. And you knew that at the beginning, the 30% to even 40% of the patients that you were going to do surgery on would be back within a year or two with the same symptoms. And that was not appropriate. I got to the point where I felt that was not appropriate and that I was going to relieve myself of the bias, my bias as an oral maxillofacial surgeon, that surgery was the answer, and begin to look and to study and actually do an investigation by asking the patients, first of all, what's needed and wanted. And what the patients want is they want relief of their symptoms. They are not knowledgeable about how the body works. They're not knowledgeable about the things that we are taught in our professional programs. They have no idea what's going on. All that they need and want is they want the symptoms to go away. Now, if you're a good practitioner, that's what you want. You just want the symptoms to go away, and you want to be able to help that patient make the symptoms go away. But you have to do it correctly, to do it successfully, you have to disavow yourself of your biases and look at what is really going on. And so what happened is, I've told this story many times, I began just talking to the patient, asking them what's needed and wanted, and asking them to tell me everything they could about their problem, their symptoms, what they thought of the symptoms, everything they could tell me about the symptoms. And they told me, if I put my finger, my tongue, a pencil eraser between my front teeth, it feels better. That was the key. That was the key that allowed me to make a device that went between the front teeth that the patient could wear long enough, consistently enough, that they could speak with easily, so that they could wear it long enough, 24/7 for 2 months, nicely, except when they eat, at which point the symptoms began to go down, and sometimes, most of the time, very rapidly. Painful symptoms would come down very rapidly. And it was all because I asked the patient what needed and wanted, what was needed and wanted, got rid of my own bias as to what I thought was the right thing to do, and just supplied what was needed and wanted was something that went between the front teeth. And then the rest I had to figure out, well, how did it work? What's really going on there? Well, that wasn't really hard to do with a broad knowledge of anatomy, physiology, a little cell biology, of the mechanisms of the oral and maxillofacial masticatory system, which an oral and maxillofacial surgeon with degrees in dentistry and medicine and cell biology should, any of those doctors with those degrees should know pretty well how the system works. So that is exactly why, regarding TMD, TMJ, we need to apply what's needed and wanted and get rid of our biases. I ask you to do that. And for those of you who are interested in joining our network of providers, our group is supported by myself and our company to use a device that works extremely well and very simple. You can discuss it with me at any time by shooting me an email at tony@tmjservices.net. You can look into everything that we can enlighten you on regarding our study and why decreasing inflammation within the temporomandibular joint, simply removes, decreases, ameliorates all of the symptoms of TMD quite easily over time. It's not a one-off thing, but over time, you can make all of those symptoms decrease by using a very simple system. If you'd like to investigate that, look at our site, www.urbanictmj.com. I encourage you to follow me along in future episodes of TMD Demystified. I do them every Tuesday morning, and I definitely like to educate and get feedback from our listeners, our followers, our viewers. And if you would like to even criticize, I am definitely open to criticism. If you have a critical comment, I'm happy to take it. I'm happy to respond at any time. With that being said, I look forward to the next time that I can present to you. I enjoy doing this, and until next time, I am Tony Urbanic, and this is TMD Demystified.